All right, good morning, everyone. I am really pleased today to get to introduce Dr. Christine Kannler, who's joining us for Grand Rounds this morning. Dr. Kannler is a longtime affiliate of this institution. She received both an MD and an MPH from Boston University School of Medicine in 2000. Following that, she completed an internal medicine residency at this institution, and then a dermatologic residency at Wright State University and Albert Einstein University, where she served as chief resident. Dr. Kannler then completed a fellowship in Mohs surgery and is currently employed by Northeast Dermatology Associates as a dermatologist and Mohs surgeon, and sees patients throughout the Northeast. Her interest in occupational cancer among firefighters began after her brother Peter was diagnosed with stage 4 esophageal cancer in July 2015 at the age of 36. Peter lost a year-long battle with cancer in September of 2016. And since his death, she has been involved with the Boston Fire Department, the Professional Firefighters Union of Massachusetts, and the Massachusetts Fire Academy to increase cancer awareness through education and free screenings, and has received multiple awards for this work. This talk today is going to go beyond skin cancer and will address a multitude of health risks that are faced by firefighters. As questions come up, please leave them in the chat. Dr. Kannler will be answering questions at the end of her talk.
Thank you so much for that wonderful introduction. I would just also like to say that my positions consulting these various fire departments and fire institutions are all voluntary and not paid. So let's dive on in. So today what I'm going to do is I'm going to present some cases. I'm going to teach you about what life as a firefighter is somewhat like and the exposures that they're encounter when they are at work, and then sort of what we've done here in terms of screening and trying to educate. So the first bunch of cases are just snippets of firefighters, local firefighters. And what I've done is I've included the some highlighted statistics of a recent systemic review. And then at the end, we'll go over that a little bit more. So here, this is Kyle, he's 34, and he passed away due to non-Hodgkin's lymphoma. He was a firefighter in Hampton, New Hampshire. And you can see I highlighted here that due to the systemic review, you can see that there is an increase of both incidence of non-Hodgkin's lymphoma, but also mortality. Next, here we have some GI cancers. We have colon, gastric, rectal, and esophageal on the bottom. So we've got two cases. One is my brother on the top, and on the bottom is a 39-year-old firefighter in Maine who was screened for colorectal cancer, and he ended up having stage 4. He's still alive today, battling his cancer. But just by taking a quick look, you can see that there's a lot of yellow and a lot of statistically relevant data there, showing an increased incidence and increased mortality. Here we go. Here's, oh, sorry, I have a little slide snafu here. This is a 53-year-old in the left corner who has metastatic prostate cancer. And then we also have in the center of the slide there, this is another firefighter, a Boston firefighter, 64 years old, passed away of bladder cancer. And so there is a higher incidence of testicular, prostate, bladder, and kidney cancer in firefighters in terms of both incidence and mortality. This is 2 more cases. We have Joni up in the left-hand corner. I found her stage 3 melanoma at a free skin cancer screening at a union meeting. And she now is probably almost a year out in remission. So she is back at work and doing very well. You can see that up at the top of the slide, you can see that melanoma is at a higher incidence and higher mortality. And then I also just put our friend down here on the bottom. He's since passed as well. He is very young. He was a firefighter in Billerica. He had at least 4 years of nondescript lower back pain. And it turned out he had an Ewing sarcoma and he's since passed away. So some of these folks get really bizarre cancers. And so if you don't know to ask what their occupation is, you might not pick up on some of the clues. This is a really tricky case for primary care because how many people do you see with lower back pain? It's a lot of the population. And so just by asking one extra little question, you can gather a lot of information that could save someone's life. So the majority of firefighters in our country are male. So here are some female firefighters. So on the left is Marnie. I went to high school with her. She, at age 40, demanded that she have a mammogram. And in talking with her, the story goes, yeah, I told my primary I need a mammogram. I'm 40. And my doctor said, no, you don't. Yes, I do. No, I don't. You're a pain in the butt, says the doctor. I'll order it. Turns out she had bilateral breast cancer. She's had multiple years of therapy, but she's back on the job and is now helping other young women with breast cancer. My other female case is thyroid cancer. Thyroid cancer, there's an epidemic of it in the country right now. So I think it's hard to say that thyroid cancer is only from firefighting, but it is one of the cancers that we see in firefighters. So it's something that we need to have on our radar. And finally, I'm not going to go into this, but there's actually been a lot of studies been done by Dr. Sarah Jenke on female firefighters and infertility and birth defects. So this is a widespread issue that we need to think about when we're dealing with our firefighter patients. So the key here is the occupation. And so there's a few things about the occupation of firefighting that is a little bit different than your normal job. So number one is the overnight shifts. They get woken up in the middle of the night, and that leads to circadian rhythm changes in hormones. That leads to changes in cortisol levels and also changes in hormone levels. So in the bottom corner, you can see this is like the first study that actually was looking at shift work and the potential risk for cancer. And so I think there's going to be more data to come on this. So it's something that I want to raise your attention to. Usually what happens is there can be some weight gain after a firefighter starts. And some of this is because of these incidents of being woken up in the middle of night after a call, they go to the kitchen, there could be some eating that happens, and then it's hard to get back to sleep. There's cumulative stresses. They see a lot of horrific things. And so their behavioral health is extremely important with firefighters. And so I want to really stress that because you really need to ask them how they're doing. There is a lot of PTSD. There is suicide in firefighters. And then there's also, as with any population, when you have behavioral health issues that are not being addressed, there is alcohol and drug use that can sometimes occur in this population because they're trying to self-treat. So that's important to address as well. To be a firefighter, you have to be a tactical athlete. We'll get to that in a little bit. I have a handout for you folks, and it's also my slide, and we'll get into that in a little bit. But just realize when they have all their gear on, that's 70 pounds. The jackets, the oxygen, it's 70 pounds. The hat, the helmet rather, it's really heavy. So that in addition to the heavy hose and running and knocking down ceilings and whatnot, it takes a lot of muscle strength and core strength to do their job. Let's focus now on what the fire scene looks like and the carcinogens that they're exposed to. So when flame retardants combust, they release dioxins and furans. Plastics release polyaromatic hydrocarbons and formaldehyde. The diesel exhaust from the fumes, they're exposed to it both when they're on it, but when they back into the fire station, which then gets accumulated in the station. And then finally, in the gear and in the foam, there's PFAS in that as well. And we'll talk a little bit more about that in a minute. So fires are different now. So about 50 years ago, fires were basically wood and metal. And so you can see in this photo at the bottom, this is 2 fires simulated. One is natural, which is what basically fires were 50 years ago, and the other is synthetic, and that's a current fire. And so this is 4 minutes into the fire, and you can clearly see that the fires from 50 to 70 years ago, they burn slower with less smoke. And the synthetics from the current fires burn faster, hotter, and more smoke. So what's happening with that smoke? So we know that a lot of these chemicals carcinogens that I've mentioned are forever chemicals. They don't, when they burn, they don't disappear. They get converted into aerosolized particles, and they also get converted into soot. And so it's very interesting that the original studies on cancer in the fire service actually started here in Massachusetts. The Boston Fire Department had realized that their firefighter colleagues were dying more in the 80s. And so they did cancer registry data. And they showed that firefighters had more cancer compared with police, compared with all other occupations in Massachusetts. The problem is that it's a small study. And so that's part of what we're seeing here at this firefighter story of cancer, is that you need to get a critical amount of power when you're doing statistical studies to actually show that there's an effect. So during the fire, after the fire, when there's no flame, and it's called off-gassing, there's a lot of chemicals that are becoming airborne. These chemicals are being ingested when people are talking. Right now I'm eating air as I'm lecturing to you. They're being inhaled, but they're also landing on people's skin as soot. And soot also has carcinogens. Once again, their equipment has PFAS in it. So that's a nice thought that soot's landing on the skin, but what's really happening? So you can see up here that I have a little diagram of the skin, and when we get hot and we're running, regardless of whether there's a fire there or not, our blood vessels dilate to get the food to the muscles. We start sweating, our pores dilate. And so there's been some studies looking at the absorptive rate or the skin permeability. And so you can see in the bottom slide, the groin area permeability goes up 300 times. The neck goes up, or the jaw angle goes up about 100 times. The forehead is 43 times. So when the soot lands on the skin, it is getting through. There's this other study. It's kind of like one of those fit tests when we go for our TB masks. They spray that orange fluorescence, and if you can taste it, you know your fit mask doesn't work. Here was a firefighter that had his full gear on, and they sprayed aerosol that fluoresced, and you can see they've blocked out his face, but you can see there's a lot of skin contact and thereby absorption. So that's all nice, well and good, but is it true? So what they did then is they looked at blood of firefighters before and after a fire. So the dioxin level of firefighters increases from before a fire till after a fire. And then they also looked at the polyaromatic hydrocarbons, both in the urine before and after, and that goes up 3 to 5 times. So we know that these chemicals are within the bodies of firefighters. It's really interesting because when you talk to a firefighter, they'll tell you for 3 days after a fire, they smell like a fire. And so when I'm teaching firefighters, I'm teaching them that your body doesn't know the difference between that great Italian meal with lots of garlic and then you smell like garlic for a couple of days, as opposed to being in a fire and your body's trying to get rid of all of these chemicals. So what do internal medicine doctors know about firefighters? There's only this study, and it's about cardiovascular health. And basically what this study says is that firefighters have a lot of cardiac events at the initiation of a call, during a call, and immediately after. And that's usually when a cardiac event will happen. And so it's not hard to think about this. Yeah, of course they're going to be at increased cardiac risk because they're running, their endorphins are going. It's a lot of stress. A couple of years ago, I was looking at the New England Journal and I saw this article and I thought, wow, maybe there's other things going on as well. So what this article talks about is pollution in the heart. And when you look at this diagram, they talk about how all of these chemicals and toxic metals affect cardiac health, and how maybe this is a lost opportunity in our medical environment by not capturing this data in regards to cardiac health. And so I can tell you that every diagram here are chemicals or metals that firefighters are exposed to in a fire. So maybe it's not just the endorphins and the stress when they run into the fire. Maybe there's also a pollution component as well. So what also is there that doctors might not know about? There's a culture, and it's funny because in some ways the culture is very similar to our culture. They're heroes, they run in, they save the day, they're in control of the fire scene. There's a lot of overlap. And you know, they might not be the best patients, but a lot of medical providers aren't the best patients either, one could argue. They tend to be mostly males, although that is changing. A lot of them have previous military training, and I just raised that because this article that was in the New York Times talks about the burn pits that were happening in Iraq. And so we could have multiple exposures over long periods of time of these chemicals. That could be cumulative. It's family. We talked about the shift work. Many firefighters have another job on the side, which may contribute to occupational exposures. There's different types of firefighters, and your role in a fire varies as to what type of firefighter you are. It also depends on when you get there. If you're the first company there, your exposure is going to be a lot different than the next company that's the mutual aid. I'm going to talk about professional versus call vol in a minute. There's also other positions. So like my brother, he was a Chelsea firefighter. So a lot of exposure there. He was on the hazmat team, a lot of exposure there. And he was a teacher. He was a firefighter teacher in the burn building. Huge amounts of exposure. So you can see how these exposures can layer upon each other, increasing risk. Different types of fires are different. A car fire is definitely different than an industrial fire, which is different than a house fire. And interestingly, the worst fire is a Teflon pan in the kitchen. And they haven't been gearing up in the past for that fire because it was considered safe. So why did NIOSH study firefighters? So the federal government has studied firefighters. So the reason why they studied was because the union data, which only captures professional firefighters, so that's a limitation of this data. And it's also limited because not all states during this time frame considered occupational cancer as a line of duty death. But in this pie chart, you can see that for about 20 years worth of data, the majority of line of duty deaths were cancer. Cardiovascular deaths were about 20%. The rest of it is a very small piece of this pie. So NIOSH did a study of 30,000 firefighters, and this was in 2014. This was the first study that really had enough power to show that there was a difference. And this study looked at 3 different areas of the country, and they found that overall cancer was 9% elevated incidence and a 14% higher mortality. They did not look at melanoma. My heart was broken. No, I'm joking. The 2014 study in the Nordic countries, which was 45 years worth of follow-up data, the study showed the same thing as the NIOSH study, but what it did show is that melanoma and prostate cancer were happening in firefighters aged 30 to 49. So that's markedly different than the typical Caucasian 65-year-old gentleman that shows up with a melanoma. And it's also markedly different much earlier for prostate cancer. So just taking a step back, so prostate cancer, why would that happen? I don't know, but if you know that your groin is 300 times more permeable when you're in a hot environment running around, and if you know that the equipment that you're wearing has tons of PFAS in it, I don't know, maybe that's why. Who knows, it's just speculation, but it could explain what's going on there. So this is the overview of epidemiologic systemic reviews. And so basically the difficulty here is that, as I've explained earlier, it's really hard. Every fire is different. Your position is different in the fire. So to try to do an epidemiological study of exposure where the exposures vary so much, it's really difficult. But this is the review, and it does show that, as you've seen in all the previous slides, that there is some consistent evidence that there is an increased incidence and an increased mortality. So speaking about epidemiologic studies, there was the World Trade Center tragedy, which from a public health point of view was very fortuitous because you had a ton of firefighters exposed to the same exposure. What this study, this is 14 years of follow-up data, this showed that melanoma was elevated, prostate was elevated, thyroid was elevated, and tonsillar cancer were elevated for this exposure. It's interesting that there weren't other cancers that were elevated, but it probably has something to do with the type of exposure that was related to the World Trade Center. What I found particularly alarming was that the firefighters that arrived on September 11th had a statistically higher rate of prostate and thyroid cancer compared to the firefighters that arrived on September 17th. So there's definitely something to the exposure of these environments. So not all firefighters are created equal. Basically, the majority of firefighters in our country are volunteer. The professional firefighters are people like here in Boston, some small towns like Wakefield. They're younger. In Boston, you have to have military experience. They tend to be more fit, and they have insurance with their job. The others are people who work in any job during the week or whatever job they have as their full-time job, and then they volunteer. They don't tend to have health insurance that's related to their fire position. They might not even have health insurance, period, depending on what their primary work is. They tend to be older in age, and these firefighters have less resources. And that's important in terms of, at the end, I'm going to tell you a little bit about what firefighters have been doing to stay healthier, but they're at a bigger disadvantage because they don't have as many resources. So this is data here from Dr. Gruber from University of Rutgers. Brian presented it at the University of Miami Fire Symposium. And you can see here that basically career volunteer are both at risk for cancer. They are older, the volunteers, and they're more obese. So there's some thought too that the obesity with the chemical exposures and then throw in a little bit of PTSD and maybe some alcohol abuse is also playing a role. So it's definitely multifactorial, but it is something that there's a lot of things that we can try to help them find cancer earlier. Sorry about that. So moving right along, and this year in the Lancet Oncology was published the International Agency for Research on Cancer. Firefighting is now a group 1 carcinogen. And so basically, this is really complicated statistics that's a little bit out of my league. But what this study showed is that mesothelioma and bladder cancer are a big problem for firefighters. That it's definitely, firefighting has been associated with those risks. They say that there's limited evidence for colon, prostate, testicular, melanoma, non-Hodgkin's. But limited sounds like it's not a big deal, right? It doesn't really convey much worry. But in reality, that's not true. When you look at the mechanistic evidence for exposure for firefighters, they contain all 5 mechanisms. You can't get any more mechanisms than 5. So we know that these chemicals they're toxic to genes, there's epigenetic alterations, there's oxidative stress, which also plays a role with the cardiac. If you go back and look at that heart and pollution study, they talk about oxidative stress in that. There's chronic inflammation, and then there's modulation of receptor-mediated effects. And it doesn't really matter what type of fire. It's just the exposure will vary. So when you look at what category, what do you need to do to get a group 1? So if you can see here for firefighters, there's significant evidence for humans, inadequate for animals, but there's strong mechanistic. And so that's why overall it was a group 1. But I just want to show you that you can get to group 1 or limited, you can have sufficient evidence in a few of these categories, and still limited covers a very large area. And in speaking with Dr. Jeff Burgess, who's on the committee, he has informed me that these other cancers that are limited are actually extremely serious. So what can you do? What can you do as a primary care doctor? So about 4 years ago, the first edition of this firefighter medical evaluation form came out. It was a 4-page form. And this actually was based off of Dr. Michael Hamrock's work. Dr. Michael Hamrock was a Boston Fire Department, on the Boston Fire Department as a firefighter. He saw all of his colleagues getting ill, and he decided to go to medical school. He went to UMass, and then he became a primary care doctor who works at Stewart. And he, up until about maybe 6 months ago, his panel was firefighters. And so what he did is he made the first version of this and gave it to the firefighters in Boston. He found that that didn't work out. So what he did is he mailed it to all the wives of the firefighters. So then people were coming in to get their studies. And since then, this has been updated, and we have some nice graphics. It kind of explains what firefighters do is in terms of tactical athletes. I think the important thing here is that it tells you all the information you need to know. It tells you that their risk of cardiovascular disease is high and what kind of tests should be done for them. It tells you about the cancers that they get and when screenings optimally should start. It's hard in screening to, sensitivity and specificity. You don't want to screen everybody, but you got to kind of find that place where we can find cancers when they're still early. And so at this point, it's 40. And this comes from, you can scan the QR code, and it has all the physicians that were a part of this, which is a lot of occupational health doctors. There's a lot of literature in the occupational health about firefighters and cancer. There's really none in the internal medicine journals. Starting screening at 40 is a great idea. It wouldn't have helped my brother. But we got to start somewhere. Behavioral health is huge. You got to ask these folks. There's actually a really nice behavioral health PTSD outfit out in Western Mass for firefighters called Onsite. So there, and also McLean has a nice first responder behavioral health program. So there are resources out there. Sleep disorders definitely need to be worked on. And finally, lung disease. You'll hear people say, yeah, I went to that fire 2 years ago and I've been coughing ever since. Sounds like they need a PFT or something that needs to be looked into. So the other thing that I've done is I've reached out to the U.S. Preventative Task Force, because the U.S. Preventative Task Force is screening recommendations for the average American. These folks are not average Americans in terms of exposure. And just in the line of work that they do, I don't think I'd go running into a burning building. So we need to think about them. So what have we been doing here in Mass? So starting right after my brother passed, I thought about things because I had read up about firefighter cancer. And I thought, well, I can make a change. I'm a dermatologist. Melanoma is high. The American Academy of Dermatology has a free skin cancer screening program called Spot Me. So I started calling the union, Boston Fire, and then I also reached out to the fire services department in Mass. And I said, hey, I can offer free skin cancer screenings. And so up to date, I've done over 3,000 skin cancer screenings. And what we've been able to do with the collaboration of the union here and the Department of Fire Service and the State Fire Marshal is we've been able to create a little screening program. And so what happens is a local fire department will call Abby Baker at the fire service department and say, we would like the fire and the cancer service education class. And so the National Firefighter Cancer Support Network has created a very nice educational video. So one of the fire teachers goes to, or instructors goes to the town, gives them the course, and then about 2 or 3 weeks later, I show up and I do, or we now have other dermatologists that are volunteering, show up at the fire station, captive audience, and we do the free skin cancer screening. And then if something's found, they get flagged. The Department of Fire Service website has a lot of great resources. So I've basically cut and pasted. You can see that there's a table of contents. Take a look. And if you just Google Department of Fire Services occupational cancer, this is what comes up. So then about 2000, we finally got a grant from the state to screen firefighters because we knew that we weren't really making any headway with trying to explain to insurance companies that it makes more sense to screen these folks earlier so we can catch these cancers early when they're treatable, but also just from a cost perspective. I mean, that year of treatment for my brother was really expensive. And honestly, I knew when we were starting that it wasn't going to work. I mean, how do you cure stage 4 esophageal cancer? You really can't. So basically what happens now is the firefighter has to live in Massachusetts. They have to be on the fire service for 10 years and you have to be 40. And if all of those, and you have to go to one of the educational videos or get educated about skin cancer. And then they can qualify for a free CAT scan, low dose lung CT, which is the same one that smokers get. Smokers get this. I don't understand why firefighters can. It's the same chemicals. They're inhaling them. It's part of their job. So they go and they get their CAT scan. If they choose, they can stay in the scanner for 5 more minutes and get a cardiac calcium score. They have to pay for that on their own because it's a cancer screening grant. But we've found there's a firefighter down the Cape, 49, 4 kids, widowmaker, found it, 2 stents, he's alive and back on the job. So what's going to happen is that they can't get the lung CT unless they have a primary care doctor because this data has to be HIPAA compliant. And so it goes to the primary care. So previous to this, we've been sending firefighters to their primary cares with the handout that I just showed you, the firefighter handout. And firefighters were coming back and saying, yeah, my primary care just looked at me and shook his head or her head and threw it out. We've had some primary cares that are like, oh, I didn't order this CT scan. I don't know what to do with this. So we need some help in terms of closing the loop. And I think that the education component, we need to get the education out to primary care providers so that way they know about these risks and they know that at least in the state of Mass that these tests are happening. If a patient does not live in Mass or if they're under 40 but still have 10 years in, they can actually pay for their own out-of-pocket lung CT. We had that written into the grant. So let's talk about the cancer presumption law here in Mass, because that's important. Those first studies that were done in Mass in the 80s, that actually led to the cancer presumption law here in Massachusetts, which has helped our firefighters here in Mass, and not all states have this. Firefighters in Massachusetts are actually extremely lucky because there's no other program like the screening program that I spoke to you about, and they don't have as many benefits if they do get sick. For example, the first photo of Kyle, he was not a line of duty death, and that's really bad. I mean, a young wife, young child. So basically, in the state of Mass, cancer is covered, to cut to the chase. The difficulty here is that the latency period for some of these cancers ranges from 3 years for leukemia to 35 for mesothelioma. If you were ever to get a workers' comp piece of paper, for a firefighter, you're going to write that it's probable. The cancer is probably because it's a more than 50% chance that their cancer is due to their occupational exposure. If you write probable, then workers' comp will actually look at it. If you write possible, the paper just gets placed aside. And this is stuff that we don't learn in medical school. In Massachusetts, a firefighter can choose to go to whatever doctor they want for their cancer care. There's legislature to provide them that option. So you may see stuff like this. You may have a firefighter patient. So here, once again, is just that any firefighter, disability or death due to cancer, lungs, respiratory tract, hypertension, heart disease, nice concise slide. So what else is going on at the State House that you might want to know about or maybe would be good to know about. Basically, the fire marshal here has put in legislature to expand the screening to include PSAs for firefighters at any age, mammograms, and soon there'll be ultrasounds. The other thing is that Massachusetts has an act regarding the toxic chemicals in firefighter personal protective equipment, so their gear. It's difficult because I don't know what they're going to use for gear, because PFAS is flame retardant and water repellent, which seems like that should be pretty good, but it's not. And if you wanted to learn more about that, read the book Exposure about the DuPont dumping. It's kind of like a civil action. The book's called Exposure. Here's another act or bill that's up at the State Department about requiring insurance coverage for annual lung cancer screenings for firefighters. Charlie Baker did a lot of, signed a law, and that's where a lot of this, a lot of the movement with the protection for our firefighters came from. The 2 years before he signed that law, there were 300 active duty Massachusetts firefighters with cancer. So exciting news is that in 2022, we seem to have made some progress into speaking to health insurance companies. So Unicare Health has now, here's the letter, they're willing to screen firefighters at an earlier age for health conditions that are related to their firefighter activity. So hopefully we can get other insurance companies to get on board, because it will help the ordering of these tests from the medical point of view. So I'm here to educate, and I hope we can spread the word about the exposures for firefighters. I would love to grow my primary care panel for firefighters. At this point, when I go and talk to firehouses, I'm like, anybody got a good primary care? Let's add them to our list. I have a list of primary cares that I've never met that firefighters have told me are receptive to screening them and listening to their concerns. If you are interested, here's Abby Baker's contact information. I have published, or no, I haven't published anything. I have written at least 5 articles, viewpoints, opinion pieces, and I can't get published. So if you can help me, please let me know, because I think that we need to get the information out there. The other thing that you need to know is that the federal government passed the Firefighter National Cancer Registry. So they're collecting data on firefighters. It's a big project. It's going to be a while till we have any data. I already mentioned the health insurance carriers. The other thing is that there's union standards for firefighters and the physical requirements. The problem is that primary cares don't know. So then the fire chiefs can't enforce them because the primary cares don't know. And so we've got this loop that's just broken. So what are firefighters doing? So in the past, the more it's called a salty shake. The dirtier you were, the dirtier your gear was, meant that you knew what you were doing. You had a lot of experience. A lot of firefighters, even 10, 15 years ago, didn't even have the contained breathing apparatus. And it was only for like 15 minutes of air. So they're wearing their air more for longer periods of time. They're trying to stand upwind of the fire. They're using wipes at the fire when they can to wipe the soot off of their skin, so there's less absorption. They're showering within the hour if they can when they get back to the fire station, instead of sitting around lounging and chatting about the fire. Governor Baker has given money so that firefighters have a separate set of gear. So they come back, they put their dirty gear down, they get on the next new gear if they have another call. They have special washing machines, extractors, I believe is what they're called, to wash the dirty gear. They keep the dirty gear where the engines are parked and don't bring it into the living area anymore. A lot of these firefighters, especially the call vol, were bringing these their gear home to their family in their house, leaving it in their car. The University of Miami, check out their website. They have an alarming video of the particulate that kind of gets passed around. Of course, it's not the chemicals, but it's illustrative of the chemicals. And now they have Plimo units, which when they back the engine in, get attached to the muffler to bring that bad air out of the firehouse. Some of the firehouses are being rebuilt to separate the living quarters from the garage. Emily Spare did some great research here in Boston looking at all the air quality of firehouses. Here's the ongoing study. So basically there's a few pockets. There's Dr. Jeff Burgess out in Arizona. He actually is doing a firefighter cohort study, and they were just up here in New England trying to recruit female firefighters. University of Miami has a huge program down there. Mass General is doing a low dose lung CT study for firefighters here. We've already spoken about the Mass Academy screening programs. Women in Fire, Reproductive Health, I told you about Dr. Sarah Jenke's work. And there's been a few FEMA grants for Boston and Arizona. Here are my citations, and I'd love to answer any questions, comments.
Thanks so much, Dr. Kannler. While you were speaking, there were two questions that came up in the chat. So one of them was about the studies that looked at malignancy and cardiovascular disease risk. Did they control for other known risk factors such as smoking?
So the for the cancer one, so one of the issues with smoking is that it depends too what state you live in. In the state of Mass, if you're a firefighter and you're caught smoking or you're seen smoking, you're terminated. There's a strict no smoking policy. You are correct that in previous years, there could have been overlap of smoking exposure with the cancer, but ironically, lung cancer is not typically seen in firefighters. It's more mesothelioma when you look at the numbers. So the traditional smoking associated cancer isn't usually seen. But those, I mean, we need more research too. I'm not going to say that this is the end all be all.
And the second question that came up was someone who was wondering if the higher rates of melanoma might be related to ethnicities such as Irish or Scottish descent that might be more common among the fire service.
So yes, I mean, the fire service in America, it's not, I mean, there are, it is primarily male, Caucasian. When you look at the numbers, there are smaller amounts of females and other minorities. In terms of numbers, it's really hard because until we have the database from the National Cancer Registry, which is a volunteer database, so that's going to provide some difficulty in its own because if you don't volunteer, we may miss that data. Personally, I haven't found, I've screened a lot of minorities for skin cancers that are firefighters, but it's still a small number, and I haven't that I know of any. The other problem is that the screening program, I only know if the person reaches back out to me. So it's not a perfect data collection point. We are, hopefully, I gave all the screening data down to University of Miami, so we could maybe get a bigger picture of that. But at this point, I don't have any data. I mean, the other issue too is that skin cancers usually aren't as frequent in ethnic skin to begin with, but they do happen. I have definitely seen in my career melanomas. Bob Marley had a melanoma on his toe, and that's how he passed away. And I have seen, I didn't see his melanoma personally, but but I have seen basal cells and African-American skin. So skin cancers do happen, they're just less likely. That being said, for African-American skin, for some reason, the melanomas happen on the hands and the feet. So whenever I go into a firehouse, I always educate that everyone can get melanoma and that we need to be careful about our hands and feet. Other questions?
You have also gotten some thank yous in the chat with people, some folks noting that they have patients who are in the fire service and they have not known this information.
Mm-hmm. Yeah,
and then there are also a couple of questions, just making sure we all have access to the resources that you mentioned. So I am hearing from Abby Baker, who is participating virtually, that Abby's contact information is on the Massachusetts State website. Is that form with a QR code that you showed us also available on that website? Okay.
Yeah, that website is, I'm always adding to it. So please check it out. And if there's something that you would like on it, then email Abby and we'll get it on there.
And just one question here I had about preventive cardiology. It sounds like a lot of the risk was around cardiovascular risk. I'm wondering if there's programs in place around whether it's weight reduction or exercise prevention in the firehouses.
Yeah, absolutely. And a lot of that is, it depends on, so now we're getting into that resource question that we sort of talked about before. And so the career firefighters have more resources. So here in Boston, they do a program called O2X, which focuses on clean eating, exercising, weight loss. And when Boston has those events, they do open it up to the metro area. So there are definitely programs, but it's getting it out. And it's also a cultural change too, right? And so even in these last 5 years, I've seen a lot of turnover, and now there's, younger folks, whether that's due to me getting older or COVID or who knows, but they're working out at the fire station is becoming more of a priority. And so it's a cultural change. We're getting there. It's a slow process, as everything is, but yes. Yeah. Hey.
Thank you for this talk. Very much. And I remember when you were my resident on the wards a long time ago. So the Mass General has a study about low dose CT. Is that working with your grant? That's the earlier screening with low dose CT. And if not, are you collecting data from the grant related CTs that you do?
Yeah, absolutely. So no, it's two different programs. But I really try to promote that study. I think they're also doing blood work there too, to look to see if they can find any blood markers. For that study, you only have to be a firefighter for 10 years. You don't have to be 40. And so if I meet firefighters from like Connecticut or Rhode Island, I'm like, go to Mass General, go get scanned. So for our data, we have about 2 years worth of data for the lung CTs. And so now we're starting to get that ball rolling in terms of IRBs and looking at it. So.
We had another question in the chat about cardiovascular risk reduction. Has anyone looked at or thought about trying perhaps earlier statin use in this population for risk reduction?
Not that I'm aware of. But I think it would be a really good initiative. The problem is that this patient population is at risk, and we need to study them, and we need to get the medical community engaged. And a lot of firefighters are very interested in their health. So I think it's an excellent area for further research. Anybody else? If anybody has any questions, you can feel free to email me. I noticed that I didn't put my email on the talk. Sorry about that. But you can email Abby. Abby is my right-hand woman, so she knows how to reach me. Or you can, Christine, Christine can be my point of contact for you folks too.
I'd be very happy to, and I can include your contact information if you'd like when we put the recording in the box
Sounds
folder.
great.
I know that people do have clinic at 9 and maybe filtering out. I do have a question
Yes.
about, what has been the experience with working with insurance companies who haven't, said that they're going to cover some of the perhaps slightly earlier cancer screenings, and how can, have there been any strategies that you've noticed for ensuring that these studies get covered by someone's insurance plan?
So yes, I think the best person to answer that question would be Dr. Michael Hamrock, because he's a primary care, and this is the majority, or was the majority, of his patient panel. So I think that that's an excellent question. I mean, I think it also depends. Like, if you know that your patient is a firefighter, then you'd be more apt to ask, have you been coughing? Have you, when you're after a fire, what do you, you're going to ask those lines of questions that could then trigger additional studies. If you don't know, you're not going to ask, and then you're not going to be able to capture those, the points necessary to indicate such tests. So that's number one. Number two, the cancer screening stuff, that's hard, right? Because it's going to be very difficult we'll see what the U.S. Preventative Task Force does. I mean, they require probably evidence that I'm not going to be able to provide in terms of randomized controlled studies. I don't know how you're going to do that. There's too many exposures. You can't pin it down. Every firefighter's, Boston definitely, or Chelsea was the busiest fire department in the whole country when my brother was on it. That may or may not be true today. Boston's definitely very busy, certainly more busy than Wakefield. So all of these exposures are so different. But I wrote my little inquiry, and so we'll see if they could help us a little bit. That would help the insurance company. So it's sort of like it's a which comes first, chicken or the egg, right? And so we need to. I think it makes sense for the insurance companies to just realize, get educated, and so if you have anybody that's in the medical insurance industry that I can talk to, I'd love to give them my talk, because it makes more sense. And what's the difference between a smoker and a firefighter? It's the same exposure. So we're doing some of it already. Any other questions? I know people have clinic.
Thank you.
Thank you, everyone. It's what? It's not working? Oh, really?